At PIH Health, there's a special category of nursing, post-acute care. It may support continued recovery, management of a chronic condition, perhaps a peaceful end of life, all in a continuum of settings. There's inpatient and outpatient rehabilitation, outpatient social work, and skilled nursing. There's home health.
My name is Brandy Barber, and I'm a registered nurse with home health at PIH Health.
There's palliative care.
My name is Melissa Radcliffe. I'm an acute care nurse practitioner at PIH Health. I specialize in palliative care.
And there's hospice.
My name is Emily Kaufman. I'm a nurse with PIH Health Hospice, and I work in their outpatient department.
Nursing specialists with special stories.
A hospice nurse will come into patients' homes and they will help family members and patients learn how to live out the last of their days. And they don't want to go in and out of the hospital anymore. They don't want to go back and forth to doctors' offices.
With palliative care, our job is to improve a patient's quality of life, and we do that by controlling symptoms. We not only look at the person as a whole, we look at the family unit and how the disease has impacted the family, and also even going down to like the emotional and spiritual components of the disease and how it's affected their life.
For home health, I work with the community. I'm out seeing patients in their home. Sometimes it's after a hospital stay. Other times it's prescribed by the physician. We do a lot of teaching, medication management. We do a lot of wound care. I get to spend a lot of time with that patient, focused on that patient and their needs without any interruption. I get to assess, again, what their whole environment is, where they're living, who they're living with, what assistance they need, and how they would best be able to recover from whatever illness they're going through.
I wanted to be a hospice nurse because I wanted to teach families and patients a way to die in a way that wasn't fraught with fear and pain and suffering, that they could do it in a way that's, there's an easier way, a better way, and able to teach them how to not only physically, but also emotionally, spiritually, and relationally die well.
I feel like my whole career has just been like preparing me to be a palliative care nurse practitioner. All along the way, in my career, I saw patients suffering, and I saw the emotional burden that the families would feel, that the patient would feel. And so I've been just pulled to the field. Just feel that total heart tug to take care of this population of patients. I think the biggest attribute that PIH Health brings to palliative care is this sense of family. It's a very rare find to have an organization put the patient first. My whole heart behind going through and being a nurse practitioner and continuing my education was for that reason. We all are such good supporters of each other.
And also working with PIH Health, I see a difference in when I first started nursing. What I knew as home health is very different than what I know now. I've seen a lot more patients at home now that had illnesses, even some of our respiratory infection patients that we would have kept in the hospital at one time.
I did some internships here, and compared to some others that I did, PIH Health stood out. The nurses here were heard and respected. I feel like there's this hope that we have as hospice nurses. We can come in to make it better.
It just came naturally to me, and it was really about caring for people and helping people.
And everything that I've been through in my career and my personal life, God has put me here for a reason, and I'm gonna serve.